let us start with the knee joint. The knee joint is a very complex structure, and this requires a lot of neuromuscular coordination from all points. So if you are a national footballer or someone who is running around like in basketball and volleyball, they need to really get trained also in certain injury prevention strategies. A lot of countries make it compulsory for all sports persons to involve in some form of ACL injury prevention program. One of the world's commonest ACL injury prevention program, ACL means anterior cruciate ligament. Injury prevention program is known as Santa Monica ACL injury prevention program. This was the first of all the ACL injury prevention programs which became worldwide important. What was found in these programs was that the athletes who were put into this program before they went into the field had more than 50% to 80% reduction in the amount of injuries to their knee than those who were not put through this particular regimen. In this regimen, various factors like the strength, the flexibilities, the plyometrics, the burst of powers and stretching, all of them were included, and a 20 minutes warm-up regimen was given to the athletes at least 3 times in a week. So the whole mark of the injury prevention comes as discipline. If discipline is maintained and injury prevention strategies are done. Another individualized approach to every sports person or every human has got certain muscles which are more tight than what it should be, and certain muscles which are more powerful and certain muscles which are less powerful. So identification on an individual basis, what is the problem with this particular athlete while they are in a upcoming into their professional careers, that is this muscle tight, and if this muscle is tight, that should be informed to that athlete, and that person should do the particular stretching more often than the others, and this is very, very significant to get an injury prevention. Second, certain muscles there may be a neuromuscular, for example, if you look at the thigh muscles, it's called quadriceps, and the back of thigh muscles is called hamstring. It should have a good ratio of approximately 4:3, and if this ratio becomes abnormal, that is the hamstring becomes much more weaker or much more powerful than the quadriceps, then these people tend to get much more injuries. So individualized approach to each athlete and identifying his trouble and involving him in his treatment, plus adding certain regimens like Santa Monica ACL injury prevention programs so as to minimize the injury problem, should be included right at the time when people are going into sports, not at a level when they are almost into a very high. So the discipline of giving the patients the right knowledge in the right time about their body has to be included in the curriculum right from the time when they are from a state level athletes to a higher. Same thing when we look at people who are going in for recreational sports, it adds equally same to these people also, in the sense that if a non-balanced person goes into a football once in a week time, he has got a much higher chance of getting himself injured. So the people should be made aware that it's very important that you play so that your heart and lungs are good, but while you play you should not end up in getting an injury. So this is what you are supposed to do. So the knowledge helps them to work on themselves better and play without getting an injury on a longer time.